Good evening, and thank you for joining me tonight. My name is Brendan Goodger. I'm the General Manager for Primary Care Improvement here at Central and Eastern Sydney PHN. I would like to start by acknowledging traditional custodians and sovereign people of the land across which we work. I recognise their continuing connection to land, water and community, and pay respects to elders past, present and emerging. I also extend that respect to any Aboriginal and Torres Strait Islander peoples who may be joining us tonight. In terms of a bit of basic housekeeping, please submit your questions using the Q&A box. Questions will be answered after the presentation. We'll aim to have responses out to you within 36 hours, and I might take some questions at the end if we have a bit of time. An evaluation survey will pop up on your screens once this webinar concludes. Now, also please note that this webinar will be recorded. Next slide. Now, I just want to take you through some of the fantastic services that Central and Eastern Sydney PHN provides to general practice. In particular, our practice support team. And you can see the range of services provided there, so I encourage you to get in contact with them. Next slide. My Medicare, putting in a bit of a plug for My Medicare, the new initiative that's being funded by the Australian government. Next slide. And a big shout out here to our Domestic and Family Violence Program, DFE Assist. And that has a navigator and an educator who's available to support general practices in terms of upskilling in relation to how to respond to family and domestic violence. Next slide. GP CanCare is our integrated cancer care service that's been going now for nearly 2 years, with another 2 years to run. Encourage you to reach out to us if we can assist with integrating care with any of your cancer patients. Next slide. And of course, our Care Finders service, and of course our Healthy Ageing Hub. That's really based in Sutherland in Goodger. And we also have one at Newtown, but I really want to highlight the one at Goodger, who's doing fantastic work. Next slide. So tonight, I'm going to be providing a briefing on the establishment and operation of the New South Wales Urgent Care Services in the St George and Sutherland regions. I'll also address questions on the clinic tonight, and so you might want to raise any issues. And I'll try and get you a response tonight if I can, but if I can't, then we'll provide, your concern will be noted, and we'll provide a response in the next couple of days in writing. Can I also emphasise too that this will not be the only occasion that we will meet. We'll also be arranging other community briefings on urgent care services as well. Tonight, I'm going to be focusing on how the service will work to help support the health needs of the local community, and also outline how primary healthcare professionals can be involved in supporting this clinic. Now, way of background to urgent care services. So the New South Wales government has committed $124 million in funding over the next 2 years to deliver 25 urgent care services in New South Wales by the 30th of June 2025. But wait, there's more. The Commonwealth have also committed to delivering 14 Commonwealth Medicare urgent care centres in New South Wales. And in our region, we have a very successful clinic based at Maroubra. The aim of these urgent care services is quite simple. It really is around trying to ease pressure on local hospital emergency departments. UCSs, urgent care services, will give our community more options to see a health professional when they have an urgent but non-life-threatening need for care and are unable to access the usual GP or other care provider. So this really is around trying to boost up the capacity of primary care providers to assist emergency departments who often provide care to relatively low acuity patients. Next slide. Now, in terms of how we selected the New South Wales Government urgent care sites, there was an EOI process that was opened up by the Ministry of Health in late 2022. And on behalf of the Ministry of Health, CESPHN sought interest from general practices that may have the capacity and the capability to operate an urgent care service in both of our local health districts, Sydney Local Health Districts and South East Sydney Local Health District. We worked really closely with local health districts in making recommendations to the Ministry of Health, who then confirmed the locations and the service providers. Now, tonight, I'm pleased to let you know that we have now commissioned 2 service providers to operate our urgent care services. They are 4Health, who will operate the Caringbah Medical and Dental Centre, and also Eastbrook Medical Centres as a provider of the UCS, which will operate from their practice at Carlton. Both providers are extremely experienced. 4Health also deliver the urgent care service at Maroubra, and Eastbrook Medical Services provides a number of urgent care services across the country. So they're both very experienced providers. So I just wanted to highlight and bring to your attention the potential benefits of the urgent care service model and about where it's come from. We know, based particularly on the evidence down in Victoria, and while Victorians are a little bit different from New South Wales, they're not that different. We know that regions with urgent care services had significantly lower emergency department attendance. Utilising the Victorian data, about 100,000 plus attendances across 25 urgent care clinics in the last 6 to 12 months. About 60% of those patients treated indicated that they would have attended an ED without the urgent care service. So this shows you the potential of how urgent care services can better support local health districts and the emergency departments, while also boosting up the capacity of primary care to deliver low acuity services. It must also be acknowledged that our local EDs, Sutherland and St George hospitals, are under pressure, and primary care can assist with those more lower acuity patients who may present, the category 4s and the category 5s. Urgent care also provides an opportunity to respond to local community needs. And again, as I've highlighted, it's also about trying to improve access to primary care. And we know that's been a significant issue. We know that primary care is the underpinning of Australia's healthcare system. That's where people go largely for their care. So the benefits of the urgent care model is really about trying to increase and acknowledge the expertise that exists within primary care. Of course, the other benefit is around reducing wait times in ED and allowing ED staff to focus on those with more acute and more complex conditions. Next slide, thank you. So in terms of locations and launch dates, the Caringbah Urgent Care Service, which is located at the Caringbah Medical and Dental Centre, will launch next Tuesday, the 19th of December 2023. Now, we have brought the start date of this somewhat forward. Why? Because we know that many local general practices will have reduced hours and or will be taking a break over the Christmas New Year period. So we felt it was important to at least have some access to primary care during that period of time, at least provide an alternative to that of the services provided at EDs. The Carlton Urgent Care Service, which is located at the Eastbrook Medical Centre in Carlton, their launch date is at the moment the 30th of January 2023. And if we could bring that forward slightly, then we'll try to. But at the moment, that's the launch date. Next slide, please. So one of the really critical issues around urgent care, which is a relatively new concept here in Australia. It's been operating, of course, in other countries quite successfully, such in particular in New Zealand, is about ensuring the quality and safety. That is paramount, absolutely paramount. So the providers will have to adhere to the New South Wales Urgent Care Principles and Operational Guidance. They'll also have to adhere to data reporting requirements. They'll have to agree to provide services at no cost. I want to repeat that. They'll have to agree to provide services at no cost for Medicare card holders and community-based asylum seekers. There'll be no out-of-pocket expenses for those attending if they meet the eligibility criteria to be seen at an urgent care clinic. And that applies also to both Commonwealth and New South Wales urgent care clinics. There'll also be agreed escalation pathways with local emergency departments and also with New South Wales Ambulance. We have been very successful in establishing these pathways with the Maroubra Urgent Care Clinic and Prince of Wales and Sydney Children's Hospital and the ambulances, New South Wales Ambulance. There'll also be a very robust evaluation framework established, because what we want to do is better understand the effectiveness and also the efficiency of the urgent care services in meeting community needs, and doing that in a way that recognises the value of primary care, but making sure that it's also delivered in a safe, high quality, effective manner. Next slide. So there are some important criteria that I want to take you through now, which is that the service will be open for extended hours from 8 to 8, 7 days a week. Now, for the one at Caringbah, whilst we get settled in, that's starting again next week, we'll have a soft start on that. They'll start from 8 o'clock to 6 o'clock at night until the 15th of January, and then go from 8 to 8, right? And by 7 days a week, yes, I'm referring to Christmas Day as well, right? 7 days a week, 365 days of the year, right? They will charge no out-of-pocket expenses for patients. That is fundamental. They will treat urgent but non-life-threatening conditions. Their role, and I want to be very clear on this, is to provide treatment of episodic care, right? It's for urgent conditions. It's not for, if you like, regular care. That belongs to GPs, to general practices, and to the usual primary care provider. It'll be staffed by dedicated UCS doctors and staff. This will be a GP-led approach, but they'll absolutely be supported by nurses. Now, the clinics at Caringbah and Carlton, they'll be run within the same premises, but they'll be run separately from the medical centres. However, we're going to work in conjunction with the same management team. And again, as I said before, we're working with the practice with linked systems, but they will be run separately to make sure that patients who are seen at the urgent care service are truly urgent care patients, and they'll be triaged. We'll also work in collaboration with local hospitals, and it's a really key requirement that they work with the PHN and local hospitals, and also adhere to the UCS operational guidelines. Can I say that we have a contract with both providers? We have commissioned both of these providers under very strict criteria. So we will have, well, we've got those contractual arrangements in place, and they'll be subject to the normal contract monitoring that our PHN does so well. Next slide, please. Now, what's really important too is that the urgent care clinics be integrated as part of a wider health network, and also allow patients to directly access or be referred to the UCS by a number of different ways. By urgent care triage lines, through Health Direct, and I'll speak more about that in a minute. There can be patient self-referrals that may include walk-ins, okay, people walking up to the practice, redirection from local emergency departments, and of course, referral from other local GPs and other health service practitioners. At Maroubra Urgent Care Clinic, we're seeing, increasing number of patients being referred by other local GPs who may not have the capacity to see some of these patients who have urgent but not life-threatening conditions. And of course, there may be ambulatory redirects. Now, we also acknowledge that some patients may phone up the two urgent care clinics themselves and ask to be seen. Now, what we're saying here is that we would prefer if they contact Health Direct and then be triaged and then be offered an appointment in at the nearest urgent care service. However, if they do contact the service directly, then they'll be triaged accordingly, right? So no one escapes triage. And if they do ring up and request an appointment, then they'll be asked to call Health Direct. But if they are really keen to attend, then they'll be triaged when they arrive. Next slide. And again, the reason why I've mentioned Health Direct is because New South Wales Health has partnered with Health Direct to develop and implement a single front door, right? And so the aim of the single front door is to try to make sure that patients get the right care at the right level that they need. And so there's a whole range of different services that New South Wales Health are investing in to ensure that some of the load is taken off emergency departments. And so that's why there'll be a nurse who will be at Health Direct, will help triage them and making sure that people get access to the right care that they need. And again, there'll be health promotions around calling Health Direct. I accept that Health Direct may not be that widely known at the moment, but there'll be information campaigns that'll be developed around that. So the role of Health Direct will be to assess and do an initial triage of the patient. They'll also make an appointment to the nearest UCS or other healthcare provider, as I've said. Patients can also be directed to the ED, or indeed have a New South Wales Health ambulance attend the patient's location if clinically necessary. So you can see the value of the role of Health Direct. Next slide. So I mentioned before around the promotion strategies for the urgent care services and also more broadly for Health Direct. There'll be a statewide campaign for the urgent care services and Health Direct. We'll also be working closely with the local EDs to assist them in being able to make referrals through to the urgent care services. We've got our own very effective CESPHN communications team who'll be providing content that's been supplied to us by New South Wales Ministry of Health, and we'll tailor it a bit to our local region, and they'll be sending out those communications. We'll also be working too with priority population groups, such as First Nations, such as those who come from multicultural backgrounds, or indeed those who are socioeconomically disadvantaged. And of course, health pathways. Need I say any more? Well, we'll make sure that the pathways and the service of urgent care is strongly referenced in our South East Sydney local health pathways, into South East Sydney local health pathways. So the way GPs can very quickly access that information and know how to refer. And you can also see the types of advertising that we'll be doing in terms of that little graphic there, which says urgent care is now available in your local area, and here's the number to call I'm not very good at this, but have a go. 1800 022 222. And that's the call Health Direct. Next slide. Now, in terms of staffing, all hours of operation within the urgent care service will have on-site at any given time a minimum of 1 urgent care service dedicated GP, 1 to 2 urgent care service dedicated registered nurses and or nurse practitioners, receptionists, of course. And of course, they'll also have access to on-call GPs and nurses for surge capacity. And staffing will also be adjusted to reflect demand. So in terms of the inclusion criteria, which I know there's a lot of interest in, understandably, New South Wales Urgent Care Services are only intended to provide short-term episodic care for urgent conditions that are not immediately life-threatening and can be treated within a relatively short period of time. They really are there for the minor illnesses, respiratory, gastro, UTIs, mental health and STIs, and also for minor injuries, such as closed fractures, simple lacerations, simple eye injuries, and minor burns, right? And again, they're typically the cases that are seen at category 4 and 5 of the EDs. They'll be also equipped to deal with the following procedures: acute wound management, including gluing, suturing, and dressings for minor burns, incision and drainage of abscesses, basic fracture management, cannula insertion to allow for IV antibiotics and IV therapy, catheter management, and also the removal of foreign bodies from the ear, nose, and limbs. It's amazing what gets in your ear sometimes. So they'll be able to remove those foreign bodies. New South Wales Urgent Care Services will provide care for acute exacerbations of chronic disease, and that may be for things such as COPD, but not ongoing chronic disease care. That is not their role. I've really stressed that tonight. This is around urgent but non-life-threatening care. Potentially offering bridging prescriptions for chronic conditions such as hypertension, where not doing so would put the patient at medical risk. And they'll also provide referrals for radiology, pathology, or specialist care related to treating episode care only. Next slide. Now, urgent care services are not intended to treat potentially life-threatening problems such as cardiac chest pain, severe shortness of breath, or altered states of consciousness, or managed labour and birth. All right. So again, in big bold letters, only urgent care issues will be seen, and that has certainly been the experience at Maroubra, and we're making sure that we hold the riders absolutely to account in relation to this. Right. Non-urgent presentations are out of scope. We value and recognise the role of the local GP in terms of being the care coordinator. And if a patient does present whose triage is not requiring urgent care, then the patient's usual GP will be contacted and hopefully then getting an appointment scheduled, and or will go back through Health Direct and really assist that person to find the primary care provider that best meets their care needs. Next slide. So there's lots of opportunities to provide integrated care, and I've already mentioned the top line a couple of times tonight, which is run between general practice, Health Direct, nurse on call, and also New South Wales ambulance hospital ED referral. We'll also be developing other referral pathways in consultation with relevant stakeholders. And again, that's been an iterative process that we've been doing now at Maroubra. The Maroubra Urgent Care Clinic has been going, I think, for about 20 odd weeks, and we're still developing more pathways in relation to that. We're building on them, right? And really we're trying to respond to local needs and also to our interactions with the local health district who request those referral pathways. It's really important that patients are connected back into their primary care services with referrals back to the patient's regular GP and or care providers to ensure patients receive that continuity of care. That's what we stand for, and that's what we're aiming to do. Discharge summaries will be uploaded to My Health Record. And of course, if someone declines not to, for whatever reason, consent to My Health Record, then there'll be secure messaging. Plus, in addition to that, the patients will also be given a discharge summary as well. Now, it's really critically important that the patient's regular GP is kept fully informed about what's going on. We have made a lot of effort to ensure that is the case. And I have to say to you, from my experience at helping stand up the Maroubra Clinic, those strategies have been very, very effective at communicating back into local GPs. I've not heard of too many complaints in relation to GPs not being informed about their patients attending the urgent care clinic at Maroubra. And the same types of strategies will be applied for both Caringbah and Carlton. And again, given that 4Health also run our Maroubra urgent care clinic, those processes will be transferred across to the one at Caringbah. Next slide. Now, sort of already mentioned this too, but one of the things that we will be doing is, of course, establishing direct referral pathways and direct referral for follow-up care to our colleagues at South East Sydney Local Health District and also to hospital and other community-based services. And they include mental health services, drug and alcohol, community health, hospital in the home, outpatient services such as the fracture clinics, community support options, and other virtual care options, right? Virtual care options are being expanded, and that'll be a key component. We want to work very closely with those virtual care options that's being delivered by South East Sydney Local Health District. But I have to say, they've been a fantastic partner in the establishment of this urgent care service. Next slide. So in terms of governance, we've got a very strong governance structure that exists for the Maroubra Clinic. There'll be an advisory committee that'll be made up of CESPHN staff. I will chair that committee. It'll be made up of hospital representatives. GPs will be on that. We also have a consumer representative as well. Can I say that the providers will not sit on that advisory committee? They may be asked to attend that committee, but they won't sit on it. And the reason for that is because I want a sense of that for the advisory committee to be independent and to be able to give advice back to CESPHN, back to the local health district, and how we can better improve and develop the urgent care service. There will be a local working group, again, that'll have local GPs, Amnesty New South Wales, hospital ED representatives, and also hospital GP liaison officers. And again, the provider will also attend that and provide advice as is required. Now, in addition to that, we, CESPHN, will also have regular meetings with the providers. And at the start, it'll be weekly, right? Because one thing that we do know is that, given the Maroubra experience, is that there'll be a soft launch of that service next Tuesday. There'll be some settling in of that new service, and where there are opportunities that can be immediately taken to improve the service, then we will do that through having those regular meetings with the providers to get those responses developed and implemented quickly so we don't have to wait, all right? And of course, there is the statewide advisory and other governance processes that the Ministry of Health will have. And of course, I mentioned that too, that there's a consumer group, there's a data group, and they've also got GPs and primary care providers and consumers well represented on those different groups. And of course, PHN CEOs are also on that group as well. Next slide. So it looks like we're going to be able to have some time for some questions tonight, which is great. So the next steps for us is around community engagement. We think that's really important. And we really want the community to come along on the journey for us. Again, we're going to start working with those local communities to really inform them of the opportunities for urgent care. But it's also really important too that the Ministry of Health will also inform the local community around the role of Health Direct. I can't emphasise that enough. We know that Health Direct may not be that widely known, so there's going to be a need to further promote Health Direct service into the community. And also with the community as well, it's also about saying, here's urgent care, and informing them about the choices that they have in terms of attending ED and perhaps having slightly extended wait times if you're a low acuity patient, versus being able to be seen relatively quickly at an urgent care service. So making them available, or making those choices available to consumers and informing them, the local community. And we know that transition will take time, that sort of behaviour change, but nonetheless, we will engage in that dialogue. I've already mentioned before around the establishment of the advisory committees. We will start to commence that, and also of the local working groups. Next steps. Sorry, next slide. Thank you for that. So we might take, so what I might do now is go to the next slide. So here are some of the most common questions, and I will get to the questions that are coming up in the chat. I've got 3 screens going at the moment, colleagues, and I'm trying desperately not to look cross-eyed, all right? I'm trying to focus on you, all right? So some of the most common questions that we've had from GPs and from other people as well is, will the patients be bulk billed? Yes, they will be, so long as they meet the eligibility criteria, all right? The other question we've had is, will the urgent care services fragment care due to patients not seeing the usual GP? I hope I've cleared that one up tonight. But if I haven't, let me say that no, the usual GP will do the care coordination and whether that person's regular GP. Nothing changes in relation to that. What's really important, what's really critically important is the communication. That should one of their patients be seen at urgent care service, that the patient's usual GP is informed about what type of care has been delivered and if there's any follow-up, right? So we actually hope that it's a better outcome to have that patient being seen by a local primary care provider than necessarily going into the ED, and certainly having their care needs met quickly. GPs, how they're being paid? Well, they're being paid on an hourly rate, and that's how there is some funding that's provided to the clinic, and of course there's also MBS as well. So that's how GPs are being paid. What's the triage process? Well, again, there'll be a dedicated triage process that will be in place if the patient contacts the UCS directly, right? And what we want to do is make sure that there's a triaging in place, so that only those people who are eligible truly get the service. Now, look, what I might do is just have a look at coming up to some of the questions in relation to the chat or on the questions. So one of the questions is, why can't Health Direct check with the usual GP first? So I guess the answer to that is patients should use an urgent care service if they need fast medical attention for a health issue that is not life-threatening, all right? Or if unable to make an appointment at their regular GP. And that's really the answer to that question. How do patients arriving with non-urgent care be triaged? Are they seen in the same practice or are they sent away? The urgent care service will send a patient back to the regular GP if their presenting problem is not an ad hoc one-off urgent issue. Triage and reception will ring that local practice to make an appointment for the patient in the next few days. I think that's absolutely critical, right? And that's what's been happening at Maroubra. The other question that's come through is, how does the linked systems ensure patients that are not urgent are sent back to the usual GP? Well, the answer to that is essentially the same process as EGs discharges that occur currently. Patients will be treated in the urgent care centre like they would in the ED for an ad hoc urgent problem. And a comprehensive discharge summary will be shared with their regular GP. The communication back to the regular GP is critical. Now, are the doctors providing this urgent care service in a general practice setting fellows? Well, the GPs who are attending at the urgent care clinic, they have ED experience and they have other further education and or advanced training. It is also a New South Wales health requirement that the UCS is a trained doctor working in the clinic at all times. This is a GP-led model. Providers have a large pool of doctors with urgent care experience wishing to work in the UCS. Can I just expand on this point? Which is, I have been pleasantly surprised, given the workforce shortages out in general practice, of the number of GPs who are approaching the providers, indicating that yes, putting their hand up and asking to work in urgent care services. That is, they want to do something, they want to use their urgent care skills, right? And I think that is really heartening, that GPs want to utilise and maintain their urgent care skills. Now, in these two providers, they are two large providers, and therefore they have the capacity to recruit and to offer training to those GPs. And so really, can I say to you is, so far, we've been able to stand up these urgent care clinics at Maroubra, but also at Caringbah, within fairly short timeframes. And I was worried about the health workforce, but in fact, we haven't really had that much of an issue in terms of being able to attract GPs. GPs do want to work in urgent care services, and that's certainly been our experience locally. Now, one of the other questions is around what is the guarantee that these practices will not encourage attendees to the urgent care centre to stay with the attached general practice. Can I say to you, great question, right? Really great question. And we know that that's the concern that some GPs, some general practices may have. Look, one of the really key things for these providers is to have a really robust quality and safety audit and have systems to identify these patients as to being eligible patients, right? They'll only see patients for urgent, for one-off care, right? And the whole goal of this is to really emphasise the role of the usual general practice, right? So they'll send their patient back to the usual GP. There's enough work to go around, and in terms of patient care. And however, can I say to you that this issue is going to be closely monitored locally? We'll be watching out for that. The providers have been put on notice in respect of that. We'll be getting very high level, quite granular data to ensure that that's the case. We haven't had that at Maroubra, can I say to you. We've had no complaints from local GPs in respect of patients being lured across, if you like, to the regular general practice. Can I say that care plans, that's one of the other questions in the chat, and bear with my Twitch, I've got the 3 screens, and I'm also trying to respond faithfully back to your questions. So will care plans be done? The answer is care plans will not be done by the Urgent Care Service. The role of the Urgent Care Service is to provide that episodic care for that sort of one-off type care. All right. So this is not about having a continuing relationship with that particular patient. That is the role of the person's regular GP. One of the other questions that's has come through is, and I want to acknowledge this, and I want to acknowledge the sincerity behind this question that someone has posed, and I say thank you to that person for raising this, which is, how is this not giving an unfair advantage to these general practices by giving them infrastructure funding support and therefore allowing bulk billing, when other practices that can also provide these urgent care services do not have the same infrastructure support? The Urgent Care Centre won't function as a GP overflow. The Urgent Care Centre really aims to ease pressure on hospitals and give those in our community more options to see a healthcare professional when they have an urgent but non-life-threatening need. We would hope that the person would actually contact their local GP first to see if they can provide that urgent care service. And if a patient does have a long and established relationship with their local GP, I suspect that that's actually would be their preference because they know them there, right? But if, however, that the person's regular GP can't see them, then of course urgent care then provides a good option to ensure that they get access to care quickly rather than that person then having to attend ED. Okay. Now, I'm just going to go back through the questions on this. So bear with me while I just catch up to some of the questions, all right? Just bear with me, which is how will the UCC communicate the standard regular GP, facilitate follow-up? Will they ask to chase results? No, that is not expected. That is not expected, right? So we do expect also that the practice nurses will also be involved as well. And they'll be liaising also with the practice nurses, right? And again, that discharge summary will be sent promptly with the patient, also via secure messaging. Now, just coming back through my list of questions as well. Now, the issue around public hospital fracture clinics, it's a good question. Again, we'll be discussing that with St George and Sutherland hospitals. All right. Look, I will check up on the issue around the operational guidance being publicly available, and we'll come back to you on that if I may. Again, a good question. Can I say to you that's been endorsed, obviously, by the New South Wales Ministry of Health that had GPs as part of their advisory group, but I will come back to you on that. Well, in terms of whether an appointment or a walk-in, well, potentially it could be both, right? That is, that Health Direct will have access to the practice's booking system and be able to make appointments directly. Or the person may not want to call Health Direct, and they may simply walk in, all right? And again, that's about finding the most timely appointment that suits their needs rather than a person feeling frustrated and then simply attending ED, all right? Now, we also acknowledge too that many patients can actually see the regular patients on the day for urgent appointments. And we often, I hear that GPs, when they're known a patient for a long period of time, they often keep a few spare appointments or can fit people in. We want that to continue, all right? And we would prefer if the person has an established relationship with their local GP and they have urgent care needs, they go and see them. But again, the urgent care centre to some extent is that if they can't do that, then they've got access to urgent care rather than them presenting to ED. There'll also be a really comprehensive triage process as well, right? Because the urgent care centre is only for certain kinds of patients. It's not for providing, again, it's for those conditions that are not life-threatening, right? Or indeed, where they are truly urgent care and where they can't wait, right? Now, it may be that when they call Health Direct may say, look, your GP's, and the person may say, look, I can't get to see my GP until tomorrow. Well, Health Direct may say, look, that's okay. You probably don't need to attend the urgent care centre, but you could see your regular GP tomorrow. From what you've told me, that sounds okay. So again, what we're trying to do is encourage that relationship with the local GP. Right? I'm going to have to come back to you around the bridging script, so we'll provide some advice on that. In terms of how patients refer to the GP, we'll be putting that onto Health Pathways and then communicating that. At Maroubra, what tends to happen is that the GPs call the urgent care clinic and that referral is then made. Okay. Well, I'm not quite sure here, but will the UCS practices profit from the urgent care service? Look, my response to that is, they're not in it to make a loss, put it that way. They have to, get a return. Like all practices do, they've got to pay their expenses, and we know that operating a general practice or operating any kind of health service is expensive. So yes, they do need to cover their costs, that's acknowledged. I will come back to you around will the GPs will be CC'd any tests ordered at the UCS. I think that's a good question. And I'll just come back to the issue around the profit. The profit really is the MBS item billing only. All right. Now, there's a few questions here that have been particularly good, and some of them we need to get back to you on, but we'll come back to you literally within 36 hours. I've sort of indicated that will be the case. And look, in terms of how mental health is a minor illness, what I would say is that there'll be some issues around mental health is a wide spectrum, and there'll be some mental health conditions that may well be have a relatively minor presentation, right? Again, that'll be up to that is part of the triage process, and for the GP to make that assessment, right? And if there's further follow-up required, then that person would either be put in touch with the appropriate mental health professionals via the ED, etc., or mental health teams, or referred back to the patient's usual GP. And I hope I've answered that question okay. All right. Now, just coming back to now, in terms of the bridging script, those bridging script timeframes will only be offered for the shortest possible time, with the aim that longer prescriptions will, of course, be provided by the person's usual GP. Sorry, I've got about 3 screens going, so my eyes were, and I'm also taking some notes as we go through as well. So I may just do an addendum to some of my answers. So again, the aim is not to provide, if you like, longer-term bridging scripts. It'll be in the shortest possible time, and I think that's the arrangement that's been reached. All fantastic questions, though, keep them coming. Now, okay. Now, I'm going to just pause there for a second, and well, in terms of whether one of the important things is to have that single front door, or the digital front door, through Health Direct. And what Health Direct will do will be to help, if you like, make sure that patients get access to the most appropriate level of care at the most appropriate time. And so patients may be referred, right, to an ED, they may be referred to the UCC, or indeed, they may actually be referred back to the patient's usual GP. Right? I want to really emphasise that. Health Direct is not about saying, oh, well, everyone's got to go through to ED or to the urgent care service. No, there'll be some conditions whereby the Health Direct may say, well, no, this condition can wait or could wait, and they should say that you could wait until tomorrow to get an appointment for the urgent to the patient's usual GP. You don't require urgent care. The same thing, by the way, for patients who turn up, who walk in off the street. Again, there'll be a triage process, and if they don't meet the criteria, then they'll go back to the patient's usual GP. Really want to emphasise that point. Not all patients who walk up to the urgent care service will automatically be seen by a GP. There'll be a triage process for that. It's possible also that the Health Direct nurse may actually call the patient's usual GP up as well, right? And to call ahead to explain situations if the patient is uncomfortable or for a range of matters. But that Health Direct could actually do that. And of course, if the patients do call up the practice themselves, and I expect that to happen, because again, there'll be growing familiarity with Health Direct, but it won't all suddenly kick in. Then they'll be triaged accordingly, right? There'll be that really tight triage process. What this is not about is it's about boosting up primary care capacity. And I've been very clear around that this is a GP-led model, absolutely committed to that. And again, but with the support of a primary care team that will involve, nurses, that will involve allied health. And I will say that at the Maroubra Clinic, for example, there's also a physio available. And we are looking as that Maroubra service starts to mature somewhat, still not quite mature yet, but as it starts to develop, then there could well be other services in terms of supporting patients in relation to mental health, for example. We think potentially that the hours could also increase as well. At the moment, the Maroubra Clinic is 8 to 8. As the numbers start to increase, we may well extend that through to from 8 o'clock through to 9 o'clock. So there are those sorts of innovations that I think are going to develop and actually over time. The other thing I'd say too is there's going to be a really robust evaluation approach built into these urgent care services. We'll be getting really good quality data from the urgent care service. And I think that one of the strengths of the New South Wales health model is that they'll have direct engagement in with local EDs, right? Because they run local EDs, right? So I think that's going to be one of the big strengths of the New South Wales health urgent care model. I think Health Direct will take a little more time, but I think that also shows tremendous promise as it becomes more popular and more is known around that. Sarah, I will take your comment in terms of, I'll come back to your comment in a minute, which is around our health services, also funded with no gap, and I will come into that, all right? And if I can't get you a decent answer tonight, then I'll certainly get it in the next 24 hours or so, all right? Now, we're coming up close to time, but we've still got 5 more minutes, colleagues. So now's the time to jump in and put any last minute questions. Can I also say to you that I know many of you down the region, in the region. Please contact me if you wish to. I think a lot of you have my mobile number, but you can also email me, right? And I'm really keen to work really closely with local general practices. That's my job, quite frankly. That's what's expected of me, and I love doing it, right? So this is a partnership between a whole number of different partners, between the local health district, South East Sydney Local Health District, the PHN, the Ministry of Health, and local general practices coming together to be able to try to take some of the pressure of local EDs, while also boosting up the capacity. Of primary care providers, right? And I think that's a critically important point, right, around boosting up capacity, and that's certainly where we're coming from, to really try and do that. Now, and of course, we've been doing a number of tours at Maroubra. So if any of you would like to have a bit of a tour around the Maroubra service, and now it's up and running for the last 20 odd weeks, let us know. And when Caringbra gets set up, and then Carlton, more than happy to do that as well, and to do those sort of tours, right? So you guys, get a sense of, can see what it's like. And likewise, I don't want to speak on behalf of the providers. That might be a little bit naughty of me, but let me try. If any of you are interested in doing shifts there, again, we can certainly put you in touch with those providers, right? You might not want to work there, 7 days a week, but you might want to do the odd shift there. Maybe it's simply about maintaining your urgent care skills, or simply getting experience to urgent care services, because we know that there's going to be great investment in urgent care. There was a national, I think it was last Thursday, there's a national cabinet meeting, and the federal government have committed to rolling out more urgent care clinics. So again, urgent care clinics, are getting funded. There'll be more on the way, right? The trick now is, I think, or the challenge rather, is to then integrate them in with existing local services, and to really try and get that integration drivers, right? Now, just seeing if there's any more questions in the chat now. Well, again, someone has asked me around, care to share how the service was selected over others who submitted an EOI. Look, it was a competitive process, and a range of factors were considered as part of being able to establish an urgent care service, which is around capacity and all those kinds of issues. Also around location, those kinds of things were considered. Again, it was a competitive process. We had an evaluation panel that looked at those, and we also then provided those recommendations through to the Ministry of Health. We also reviewed our recommendations, can I say to you, and then come back to us as the funding authority around which services should be funded, right? So a really comprehensive evaluation was undertaken of that. Now, we are now coming up to time. I think we're coming up to now to 7:59. Happy to take any last minute questions. And again, I will make the offer that people can contact me. You can also email me. I'm pretty approachable, right? And I'm really keen to help, right? So we will provide answers to these questions tonight that I haven't fully answered, because there's been a lot of questions. We'll provide them to you in the next day and a half. And again, I do look forward to you reaching out to me if you've got any other further issues. We want to make this work, right? We want to make sure that patients get access to the appropriate levels of care. We want to make sure that general practice is supported. We want to make sure that that patients be seen by GPs out in the community where they can be, not necessarily in EDs and have long wait times, etc. We want EDs to be for all those high level acuity type patients. Now look, we're at 8 o'clock tonight. Can I say thank you sincerely to everyone who's taken the time to come along tonight. I appreciate that it's close to Christmas and people are probably getting a bit tired. So my deep thanks to you all. Can I also sincerely thank all those who popped a question into the Q&A. I've done my very best in good faith to answer the questions. And again, we'll provide some more detailed answers in the next 36 hours. Just give us a day and a half to do that. Now look, tonight also there'll be an evaluation survey. So we'd appreciate your feedback on how tonight has went, and so that will pop up. That will pop up soon, I think it is. So can I wish everyone, in closing, a very peaceful and restful Christmas. There's been an awful lot of things happen this year. It's been a very, very busy year. And I also want to acknowledge my deep appreciation to general practice for all the support that you deliver to your patients. Really, really grateful. So a peaceful Christmas, everyone. Thank you.